According to the CDC, for 6% of coronavirus deaths reported, COVID-19 was the only cause that was mentioned. The CDC says for deaths with conditions or causes in addition to the virus, on average there is 2.6 more conditions or causes per death. So the question is, what are comorbidities?
Comorbidities are any chronic health conditions that can occur over the lifespan. This includes things like diabetes, heart disease, thyroid disorders, cancers, things of that sort.
Lexi Shaquin, a nurse practitioner at Mercy One, says any condition folks take medication for and have been diagnosed with by their medical provider or specialist qualifies as an underlying health condition.
Most commonly right now in the COVID era, we have the hypertension, which is the high blood pressure, we have diabetes, we have obesity, and also the people with underlying lung conditions like COPD or asthma.
Dr. Sunday Gupta, physician at Unity Point Health St. Luke, says nationally 1 out of 3 people might have high blood pressure or hypertension. He mentions about 10% of the population has diabetes and around 15 million people in the United States are living with COPD.
I believe the percentage right now is over 50% of people in the United States have one comorbidity or more. That statistic is really high for people who are having comorbidities. With people who contract COVID-19, they are at higher risk of death or complications that can occur related to those comorbidities.
The underlying health conditions are impactful because for folks who have those conditions, it lowers their ability to fight the coronavirus if they get it. People should get regularly tested by their physicians for comorbidities and should get a physical exam at least once a year.
Get basic blood work, which is lab work done, and know if they are susceptible to develop those chronic medical conditions, or even if they have a family history of diabetes and hypertension. Once they reach a certain age, they should really closely follow up with their primary care physicians.
Both Shaquin and Dr. Gupta say folks should be protecting themselves from getting COVID-19 by wearing their mask, avoid gatherings, and keep social distancing. Riley Mahan, KCAU-9 Digital.